Hello and welcome to another episode of Quarantine with Fulbrighters, where we bring you the best and the brightest minds, Fulbrighters from all across Pakistan, to talk about the great work that you're doing. And today, I really want to ask my guest, what predictive qualities does he have? How did he manage to predict the future? Because we have Sajjad Khan here with us, who did his master's in public health from University of Arizona just a few years before COVID hit, and he was the ideal person for the world. How are you doing, Mr. Sajjad?
Yeah, I'm doing well. Thank you so much for the opportunity and thank you so much for the introduction. I look forward to the conversation. And yeah, like public health is really important these days, like for the past couple of years. So yeah, we are in a we are in a world where everyone is talking about public health right now. So that's kind of, it's kind of rewarding for us people who are working in public health. So I'm glad we are talking.
So, if my information is correct, you were working on vaccine-preventable diseases even before COVID hit.
Yeah, that was kind of.
How did you know this is what the world will need?
So the thing is, when I did my master's in public health, my specialty was global health. So I came back, like I did my master, and I came back and started working with the World Health Organization in Khyber Pakhtunkhwa.
You did your Fulbright from University of Maryland, right?
No, University of Arizona.
Oh, sorry.
University of Arizona in Tucson, Arizona. So it was MPH in global health, and then I came back and I started with WHO, with World Health Organization in Peshawar. So I started with polio eradication initiative and other vaccine preventable diseases. So when after a year, then we had like a really big polio outbreak. I was in the south of Khyber Pakhtunkhwa. I was in Banu. And there was like every day there would be polio cases. So when the COVID pandemic happened, everyone was talking about outbreak and everything. And I was thinking, we dealt with this thing before. So like there would be polio case here, then would be over there. We would go and investigate and like we would see the contacts and stuff. So we were all doing that kind of work before the pandemic. And as you said, like in our classes back in 2017, I remember we had this one class in global health in which we were talking about pandemics. And I realized that everyone was saying, why are we talking about pandemics? Because we don't know yet whether it will happen or whether it will not happen.
Little did they know back then.
Yeah, they were kind of, predicting it. So all the conspiracy theories comes in. Yeah.
So you're talking about that pandemic class where students were like, this will never happen during our lifetime. This has not happened for a century.
Yeah, that's true. And everyone, like, including myself and including the teacher, they were saying, like a lot of people were saying, we are putting a lot of resources to pandemic prevention in some countries. And then we are not focusing on the issues at hand. Like we are not focusing on, let's say, HIV, TB, malaria, all these kinds of diseases which are present here, right? Like there are a lot of people, thousands of people dying of, let's say, diarrhea in children, right? And then like upper respiratory infection and all those things. Why are not we focusing on that rather than on a disease which hasn't even happened? But then we realized it the hard way right now that, it's important. It's important to have pandemic preparedness. And, I would just say a couple of more things about pandemics and the way our society is right now. We are living like the way we are exploiting the environment, we are exploiting forests, we are exploiting all these resources, globalization, our this agri businesses, agriculture farms, and all these things. These are like the perfect environment for pandemics, like for future pandemics, I would say. So like we need to rethink about all these things if we are talking about preventing a new pandemic. So this one happened, but we don't know which, like there can be another one, kind of those things. And if like, I don't know, if someone wants to read more about it, there's a book, it's like for general people.
I think there's pandemic fatigue. Nobody wants to read about pandemics anymore. The little hope that we have that COVID is mostly over now, hopefully. Now you're taking that away as well by telling us that there are more pandemics on the horizon.
No, I'm sorry about that, but this is how it is. But if we invest in prevention, so we would not get pandemic, right? That's important, right? That's a hope. Like if we do more on prevention, preventing the pandemic and like having all those kind of pandemic preparedness and stuff, so we will not have pandemics. So that's a hope. Yeah.
We've spoken a lot about COVID, and everybody's really been thinking about COVID as well. But if I may just go back to polio, you talked about an outbreak. I believe you said 2015 or 16 or 17. Um, I think last year Pakistan reported 0 cases of polio, if I'm not mistaken. So what have we done which has brought Pakistan from an outbreak a few years ago to now hopefully eradicating polio?
Yeah. So it was there was like it was 2018, 19, 2019. In 2019, we had like one, just to go to a bit of history in Pakistan, there was a big outbreak in 2014. There was like more than 300 cases. If you remember, it was the time of that militancy and stuff happening in the tribal areas. So there was like more than 300 cases, and then it started declining, and we had like 4 or 5 cases in 2017. But then again, it started increasing due to this vaccine hesitancy thing, and there was a lot of conspiracy theories about polio vaccination and stuff. And then in 2019 we had a big outbreak. It was like more than 146 cases, about 140 cases of polio. And after that and it was due to a lot of vaccine skepticism. People were not, and it's not, I'm not like, I do not want to blame people for it. There's a lot of things going on in public health, and there were like different mistrust issues with the government and with the international organization that are conducting these vaccination programs. And there is so much, I remember when we would go to field and we would talk to people, right? This was part of my job, that I had to go and talk to people. So what they would do to tell me that, I remember this one incident, and I want to quote it. Said that this guy said to me that a couple of months back, my child died due to meningitis. It's a disease, another disease. So there was no one to help me. My child died in a doctor's office, like a doctor's clinic. And after that, he was so rude. Even the doctor was rude at that time. This is how he said it to me. And where were you guys at that time? Why were you not helping me? And now, right now, my child is just, she doesn't have any issue, and you have come for vaccination. So why should I trust you guys? So it's kind of these issues, and like a lot of mistrust happening with the government too. In countries, in a lot of countries, even in the US, like people don't trust the government, the big government kind of thing. So that kind of comes in, and then people are not vaccinating. So that's why there were like localized outbreaks in Banu and in Lucky Marwat and Waziristan, and even in Punjab and Sindh, Karachi has a lot of outbreaks. But again, then the government and the international organization tried to work on vaccine acceptance, and they started again the vaccination, and kind of those things happen. And then COVID hit, and then again, like there was a lot of pushback on vaccination. So, and then another thing is the natural immunity too. Sometimes people propose that one too. There's like a lot of outbreaks, so people get immune and stuff. So, but and it was just to correct you, it was not 0 cases. It was 1 case last year. Okay. Yeah, but it is a good, like it is a hope, like 146 and then like one. So it's a lot of progress, and I hope we will be able to eradicate it. But one thing that I just want to mention it is that we need to work also on other vaccine preventable diseases too, so that like the routine vaccination has like when it improves. So with that, the polio, there's a lot of protection for polio too. So that's how, when we invest in the health system and we have a better health system that reaches out to people, even if they don't have these vaccine preventable diseases. So that's how we build the trust. And that's how it's done. Yeah. And I hope we will be able to eradicate it. Yeah.
I mean, hopefully now that a lot of funds have been diverted towards public health, especially with the COVID outbreak and the vaccination program, I think Pakistan has done a much better job than most people expected when it comes to vaccinating the population. I'm actually quite proud of our vaccination program.
Yeah, me too.
So hopefully that reduces vaccine hesitancy for other programs as well. Is it just mainly vaccine skepticism, or is this also access to global health? So for instance, you worked in the northern areas. If people don't have access to a hospital, if people do not have access to a clinic, is it just polio workers were sent to these far-fetched areas? Is that how access to health and vaccinations is provided to these people?
Yeah, you read a really good point. That's true. People. I can give you another, people, when you go for these polio workers go to these remote areas, so they ask you, when we come to the hospital, like the basic health unit or the rural health center, so there's no doctor, there's no nurse over there, and now you guys have come here to vaccinate our children. So it's part of. You're right, it's part of the overall access to health. And to one thing that's important in health is that we built big shiny good hospitals in the cities, but we don't invest in primary health care. We don't invest in health education and stuff. So one of the things that is praised about Pakistan's health system is the lady health workers. It's a very impressive program, but right now it's really underfunded and under resourced. So back then when it was started, it was praised all over. They go to these communities, and these lady health workers, they talk to expecting women, they talk to young women, they talk to about breastfeeding, about contraception, and about all these things. But right now they're like really under resourced and understaffed and under trained. So we need to invest in more in those things, like to go out into the communities and to talk to people, even if not only about vaccination, it's even about like health education, contraception, maternal child health hygiene and stuff, and all those things. So, and also now right now there is this concept called social determinants of health, a socio-ecological model, in which we say that 80% of the diseases are predicted outside of the hospital, like the way we live, the way we eat, the way we exercise, the way our lifestyle is. So we need to promote all these kinds of like healthy lifestyle, and that's done through promoting health and promoting all these things. Yeah.
I know that you work on the healthy lifestyles and nutrients, and I'm well aware of my diet, which is why I don't want to talk about that because I know how unhealthy a lifestyle I do live. We will most definitely come to that, but I think you raise a great point about how medical access needs to be looked at holistically. If you're in a let's say the globe in a place in the global north or the US or Canada, the child is born at the hospital, and a lot of these vaccinations are done at the hospital. Obviously, there's consent involved, but it's part of the procedure. It's almost part of the procedure of the child being born, that they need to go for regular checkups, that they need to check for certain things. The fact that that doesn't exist and a lot of children are being born through midwives or homes, we need to come up with an alternative system. Is it lack of resources? Is it lack of attention given to these programs that so much of the onus is put on these lady health workers to actually go from home to home, from community to community, to build that trust, to raise awareness? And we don't have mass media programs. We don't have these programs which run on national TV, which actually teach people. Is it just lack of attention, or do you feel like the community engagement is more effective than a mass media awareness campaign?
Yeah, it's a really good point that you raised. I think both are important, as you said, that like with I think it's like lack of attention overall, like in our part of in our country, I would say we don't focus on health that much. We like there is a cap for the GDP spent or the budget spent on health, so we are way below. Then we are like 1.8% of the GDP is spent on health, something like that. So it's really low. We need to spend more on, and even it's not about curative, we need to invest more in preventive health, like in public health and public health policies, and more policy makers and more like all these things. So so when I was applying for Fulbright scholarship, so no one actually encouraged me to public health, and I remember a lot of my friends were doing the same thing, that they were not encouraged to go to public health, and we don't have really good school for public health policy makers and stuff. So one is that lack of attention. Another thing that there is also important is that, like with community members, like the LHWs or the doctors or the nurses, the people who come from a community and who and like, let's say if there's a village and that there are like, I can give example of my village. We have like 4 LHWs, and all the women in the village, they know them. They know personally them, who they are, where they come from, who are their parents and their husbands and their children, everyone know them, right? So when she comes into the house and she does start talking to a woman about their health, right? So she would trust them more rather than if she gets to an ad or advertisement on TV or on radio or like newspaper. So it's kind of more personal and it's kind of more effective, I would say. But another thing that's like I should mention is that we should not put the whole burden on all those LHWs, right? You are right about that. We need to have all these concerted events, like, both mass media events and more trained doctors, more trained LHWs. And I would generally say that even like just to raise this point is that LHWs are not paid well. They're just paid the minimum wage. That is also sad, I would say. They're doing a lot of work. Even when I say that, sometimes these people like, there's a lady health worker who is also a polio worker, and she goes to all these, really hard places to work. And then they give a TV ad and say, oh, they're working hard and stuff, but they're not paid well. That's I remember like everyone
Unfortunately, they're also putting their lives at risk in
of
Pakistan,
course they
because
are.
there have been cases of polio workers who have been killed.
I think this is the only program in which around 100 polio workers have been killed in like maybe 10 years or so. I know this is just one public health programs in which that many people have killed. So, and then they're not paid well. So I was just saying that we need to, that's under resourced, and they should be paired more. They should be given more training, more support and everything, so that they can go out and like help the community. Yeah, it was a long answer to your question.
No, I love long answers. Maybe one of the reasons you were also discouraged from public health was people telling you that there's a lot more money in being a doctor in Pakistan.
Yep, that's true. All over the world, it's like that. Yeah, and another thing I remember, I mentioned this in my interview with Fulbright, and I said that they asked me about why the health system issues are there. So I said, when there is this thing, when you don't do anything after your medical college, so when you're not able to do anything, maybe it's due to like circumstances, or you don't want to study or whatever, so you end up in public health. That's normal. You just don't do anything and you end up in public health, and then you don't want to work. It's most of the time like that. So but me, like I was really motivated to go to public health, and I'm fortunate to have Fulbright scholarship, and that's how I started my journey. Yeah.
Since we're talking about the mass media awareness campaigns, have you looked at the program in Bangladesh? Because they've done a stellar job in terms of population control, and they did a lot of mass media campaigns, and even religious clerics came on television and told people that population control is something that's important for the country. I think a program like that, hand in hand with the lady health workers program, could really go a long way towards changing people's perceptions about these ideas.
Yeah, of course. We need to not, like, there's this kind of debate. Let's say you gave the example of population control. So we should, like, personally, I think if we are talking about population control, we should be focusing it as a health issue rather than just like population control issue. Like so that kind of debates can go into the mass media, that why population control or why family planning is important for a woman health, for a child health, right? So we don't want our mothers to have malnutrition. We don't want our children to have malnutrition or want them to be stunted, right? So these kinds of things can go along in the mass media campaign. And another thing is that's used in the polio program too, that there are a lot of religious scholars and religious clerics, and like, it's called like district muftis, and all those people come on TV. They go to, when I was working with the polio program, we would go to mosques, and talk to all these people. So it was I have this picture in which I'm just standing, and someone has took the picture, and I'm just like in a mosque and talking about vaccination. So you're right about mass vaccination, like, mass media campaign is important, and we need to change the debate about like we can change it, like. But another thing is that's important, that we need to, and like it's not should be a top-down thing. We should go and do pilot studies and like talk to people what they think, how does behavioral change work in a particular society. Like in Pakistan, we have different ethnicities, like we have several more ethnicities. Like, so maybe a thing work in Balochistan, but it doesn't work in Punjab, or it doesn't work in the, in Baltistan or in Pakhtunkhwa and stuff, So we need to have, like, most of the time we don't use local languages, we don't go to the cultures and stuff. So I think a mass media campaign should be tailored to the local needs, kind of those things. That's what I think.
No,
Yeah.
I think that image must have had a strong reaction as well. If you're standing in the mosque talking about vaccination, maybe even doing polio vaccines and polio drops at the mosque, may once that goes up, people will see that, and maybe in another area, a far-flung area away from where that is happening, they might see that and they might change perceptions. I think we live in a increasingly connected world like that.
Yeah, I agree with you. And that's how the, like, the image making, and that's how like, the perception change works. And there's a lot of research going on in behavioral change, so it's a really difficult thing to change behavior. So it's not a simple thing that, oh, we will just go and talk to people and they should follow. No, that's not. And we all know, you mentioned the diet thing, and everyone, we all know that,
You didn't need to personally attack me like that.
no, I'm sorry. I didn't personally. I'm just, yeah, that's true. I'm not attacking you. I was giving you like smoking. Everyone knows smoking is bad, but they do it, right? Everyone knows exercise is good, but they don't do it, right? I said you raised the issue of diet. I didn't say that you have issue with diet. So
No, I do, but I do. It's true. I do need to.
yeah.
It's such a cliche to say something like prevention is better than cure, but I think a lot of your work is about that as well. And I completely agree with you. Behavioral change is the major goal, it's the 5-year goal, it's the 10-year goal, but you're not going to achieve that in 10 days. Right now, if you want something, you have to meet people where they are. You have to actually go to them, look at their culture, and a lot of times these cookie cutter programs. And this is why I love talking to Fulbrighters, because they see things so much more holistically. A lot of times, international organizations which do not have local participation take cookie cutter programs that work elsewhere and bring them to Pakistan, and then they're surprised at why they failed. This was a huge success in Sweden. This is why local participation, community engagement, and the more I talk to Fulbrighters, I realize the importance of these things.
Yeah, that's true. And one thing that's more about like the whole systems, when we talk about this, let's say now, like, there's this important that's I was reading in the Lancet that, the when we talk about all these different kinds of health issues, mainly is due to the system. Like, just to give you an example, that all over the world there is this issue of overweight and obesity, and this. So it's not even, it's not the issue of
Not
people.
just me, is what you're saying.
Yeah, it's not just you. It's the whole system. It's like a human's normal response to an obesogenic environment. Like, we, personally, people have all these high caloric food. They don't have access to exercise. They don't have access to gyms. They do not have time after their work, right? So kinds of all those things are like multiplying each other, and like that's how we, and then, as I mentioned, that we need to work like, as you mentioned, that holistically. And with health, it's much more complex, that what are we exposed to, what we are eating, what we are breathing, and how we are working out, all these things. These are like social determinants of health, or socio-ecological determinants of health, and other things that happens in childhood, how they affect the health and later on in life, and kind of those things. Those are important, I would say.
And it's different issues for different people. For instance, America has an obesity problem, and a lot of times it may seem counterintuitive that poor people are obese, because the idea is, if they're poor, how are they eating so much? But the access they have to foods, if the only way they can feed their family of 10 or 11 is pizzas or fast food, whereas organic food may be super expensive over there.
Yeah.
So they may even be eating less than rich people, but they may be a lot more unhealthy, a lot more obese. Whereas maybe in Pakistan, we have a slightly different problem. I don't know if that is what your work has shown, that things like access to food or access to clean water is a much bigger issue than maybe fast food or obesity, or do we also have an obesity problem?
Yeah, so if This thing, you are right. When I mentioned this thing to one of my nutrition professor back in my master's, that it's almost opposite in Pakistan, and he was surprised. But the thing now, we call it a double burden of disease. So we are dealing with all the issues regarding wasting, stunting, and like access to clean water and good food and everything. And this, at the same time, we have overweight issue, we have obesity issue, we have like all these non-communicable diseases like diabetes and heart diseases. So it's kind of countries like ours, like the we are faced now with double burden of disease due to the nutrition transition. We have like, our traditional diet was really healthy, right? All the food was grown locally, we had more greens. People wouldn't take any meat or chicken or those things even maybe once a week, or like 2 or 3 times a month. Nowadays we have all these like street fast foods, and like even the big McDonald's is over there. And as they cater to the middle class and to the upper middle class, and they, because so that's how we are also getting into that. I don't remember exactly the percentage, but with our teenagers and with like people less than 30, we have obesity and overweight issue. Is more than 10-15%, I would say. I'm not exactly sure how much is it, but the overweight thing is going big. And because of the, like, we have a lot bigger middle class right now as compared to 20 years back. And those middle class people have access to those kind of high caloric food, and we don't have like exercise and those things. So we like, the bottom line is we are faced with double burden of diseases right now. We are still dealing with the infectious diseases like TB, malaria, and diarrhea, and like upper respiratory tract infections and all those things. And at the same time, we have, all of us have observed that we have heart diseases, diabetes, and obesity, and all those things too. So we are faced with double burden of diseases. And for the future, like for the future, the policy makers, it's kind of like we have to deal with both these issues. We cannot just focus on one right now. We have to deal with both of them.
I definitely agree with you. I think the middle class is increasingly facing this issue, even if in their own mind they grill the food, they do lean protein. The chicken that they're buying, it's mass produced factory food. So that chicken itself might have a lot of preservatives, might have arsenic. The meat itself might have fertilizers, or the food that they're eating, the food that the animals are eating will have
Yeah,
fertilizers. So
it's sad. Yeah.
what we're putting in our body, I have no idea, but maybe years from now, people will look at our generation and think, what were these people on putting these things in their body?
Yeah, that's true. Yeah, like the exposure, the environmental exposure, as I think you in my introduction I did tell you that I am now doing my PhD in environmental health. So these days we are talking a lot about all these exposures, like how you mentioned arsenic, right? So like maybe you would have heard about the story of Bangladesh. And Bangladesh, there's like a lot of, like, there's like mass poisoning due to arsenic, and no one was expecting that. It was not intentional. They had this arsenic in the soil, and that's how it get into the water. And now a lot of people have it's either arsenic or lead, I'm not exactly sure, but I think it's like one of these heavy metals. So that, and then like the food that we grow, the pesticides. And one thing that I need to mention is that in Pakistan, like I come from Swat, so we have a lot of, it's like an agriculture area. We have a lot of orchards and like farming and stuff. So there's a lot of pesticides that are used, and you would be eating these peaches from Swat, right?
I assume that they use less, because when I eat even an apple from Sawad as compared to an apple from Karachi, it just, at least maybe I'm psychologically projecting, but it feels more natural and fresh if I eat an apple from Sawad as opposed to Karachi. So now you're
Yeah,
stating that even that's not pure.
yeah, then that's the issue. Like in Swat, they use like we use a lot of pesticides, a lot of fertilizers. So when you go out into the fields and you're just walking, like I would do it after work, and I would be smelling pesticides everywhere. So, and another important thing is that in countries like the US, they have regulations. They have like experts who do like prepare these pesticides for the farm workers to apply. But in Pakistan, we don't have those rules. Even, sometimes they ban these pesticide and they are sent into countries like ours, right? These big
Dumping.
agribusinesses do that do a lot. And then another thing is that we don't have experts to tell us about the doses. So we just, the farmer come into our store and just take something and just put it in water and just spray it. And that's how a lot of resistance come. That's how like the residue of pesticide is there. And then with fertilizer, Swat is like a mountainous region. So when the fields are like up there, like at higher elevation, and you put fertilizers and like pesticides and everything, and when there is rain, so it runs up to the river, and river goes into like, all the water sources and stuff. So, and it's kind of, I'm saying that we have a lot of toxic exposures that we don't know. And you did mention it, like, maybe few generations down the line, our ancestors, they would be telling, what are these people doing?
Mm.
So that's kind of sad, and that's kind of important too. We need to be more aware of what we are eating and what we are using. I'm not saying individually, I'm saying like the overall, the overall impetus should be like that.
If you've not already scared our audience into starvation, I can also mention that new research shows that there is plastic in everything we eat, even to the extent that when babies are born, they're born with plastic in them because we just consume so much plastic.
Yeah, and it's, and I'm not sure it's counterintuitive that when people are saying, oh, modern lifestyle is good. So when we came into the modern lifestyle, everything is bad here. So, and now everyone is, oh, just go back to our roots and don't use plastic and don't use organic things, don't use pesticides. And so our ancestors were good in doing all those things. So, and
You've also spoiled my retirement plan. My retirement plan was to move to Sawat and have a small hut and live out my life over there. But now you've told me even that won't be healthy.
no, we have to imagine an alternative future. We have to work for that. We have to for like, we don't want to all these people to tell us to live like that. We have to work, to imagine a different future. We will work towards that.
I love how holistically you think about all of these things, whereas maybe I think a lot of people in the medical field in Pakistan might think of things as a biomedical model that, oh, this is the disease, this is the medicine, to the extent where doctors just see you for a few seconds and prescribe you medicines because they almost see a human being as a lab rat as opposed to a human being with a social life, which may be affecting that. So to think about the field of medicine and human beings holistically, how much did your Fulbright help you to think like this?
Oh, of course, it did a lot. So, and when I came, in Pakistan, as a medical student, I think there's just one course on community and preventive health, and which there's like a small part on all these things. But generally, like all over the world, maybe till like 2005 or so, people were not thinking about the social determinants of health and those things. So when I came to the US, I was introduced even in the first semester to socio-ecological model, then global health as an approach. I remember that I was reading this one website of public health school, and they said that poverty is driving diseases, right? And extreme poverty is considered a disease. So I was thinking, how is this, and these things, and then like how the different kinds of like international organization work in this field, and sometimes how they promote these policies, like let's say, so how how health is affected by all these big policies. So Fulbright did affect it, and then I in the US universities, I would encourage people to apply for Fulbright too, because in the US universities you have the option of taking classes outside of your coursework. Like I took classes in medical anthropology. Medical anthropology, like there was a class called Global Health and Medical Anthropology. It was really good to understand all these diseases and all these issues in historical context, right? Like in the context of colonialism, in the context of like economics, in the context of like gender issues, in the context of all these different kinds of nutrition and stuff. So this gives you a holistic understanding. And right now all over the world, people are just talking, it's not only biomedical model, it's not working. So people are talking about generational issues. People are talking about like, chronic inflammations, and like how chronic inflammation are driven by stress, stress, like general stress, life stress, job stress, and all these things are. So I think my Fulbright did have a lot of, a lot of impact on my understanding of public health and global health. And yeah, I would give a lot of credit to Fulbright on that. Yeah,
No, I
that's
mean
important.
my Fulbright experience was quite similar as well, and I love that this is how you think about the field of medicine and how thinking about it holistically. It's I think one of the most dangerous things in the world is limited knowledge, because people with limited knowledge think they know a lot more than they do. And especially in the medical field, people tend to have an ego about it. So once they realize that even science may not be that scientific, it's the scientific process. It's even the field of medicine is constantly growing, or even when you talk about things like gender issues, how sexism or how racism informed our biomedical knowledge a few decades
Yeah,
ago,
yeah,
and
that's important.
how if they learned that in universities in Pakistan 20 years ago, that has been debunked now. So if you're not growing, if you're not learning, then you're growing stagnant, and your limited knowledge is actually hurting people rather than helping people.
Yeah, and I think, important thing that you mentioned is, one is you said limited knowledge, right? You said limited knowledge. So I say, and one limited knowledge, and another part is that like one should be open to new ideas and new learning. And another thing is that sometimes we think, oh, we are 100% right. So I think that doesn't work. And another point that you kind of alluded to is like unlearning too, right? Like we need to like we would learn things back in like our college, or like our school and stuff, and our medical school, and like our engineering school and everything. So we need to unlearn some things too. And even from the society, like gender issues, I can give example of like our society there is a lot of issues regarding women rights and gender and all those issues. But we need to think about it, like what do we need to unlearn in this, from this patriarchal culture that we are.
Thank you so much. It was lovely talking to you, and it was lovely thinking about so many aspects when it comes to the field of public health. To all the prospective Fulbright students who are listening, who probably think like you did when you were 16 or 18, that people who don't do anything else do public health, what is your sell to them and why they should do public health?
Yeah, thank you for doing it. It was good. I enjoyed it too. So my understanding of public health is that one that you can have more impact when you do it, and you work a lot. And another thing is that and lastly, I would say it depends on the interest. Like if people are interested, in public health, so they definitely should check it out, Fulbright scholarship or any other scholarship. And another thing that I would tell, that just sometimes people think, oh, I'll not get it. So I think that's not the issue. One has to apply. One has to, like they can get help from each other, from other Fulbright students. Now we have a lot of alumni, so they can reach out and to people and just get help.
This is Dr. Sajjad offering his help. If anybody wants to reach out, please do reach out to him. But I do 100% agree. You miss 100% of the shots that you don't take. Thank you so much, Dr. Sajjad, for joining us. And thank you, everybody, for listening. We'll be back again next week with another guest. Thank you. Take care. Bye-bye.